Okay, we're going to talk about a case that we see very commonly in our clinic called biceps tendinitis. It very often involves the long head biceps tendon. And the typical presentation, patients will come in the clinic saying, "Doc, my shoulder hurts right in the front part of the shoulder. Sometimes it goes down into the bicep. It's worse with activity, worse with pressing movements." Now, there are a lot of things in this part of the shoulder. There are tendons, ligaments, etc. So it's very important to do a good exam. And for me, an ultrasound is a critical part of the exam to properly diagnose the condition. But we'll talk about some of the treatments, some of the various treatments, the way in which we treated a patient we just had today, and we'll show you some of the relevant anatomy, so hang tight.
Okay, we drew some anatomy for you here, and what I wanted to demonstrate was the long head biceps tendon. So the bicep muscle, the bicep brachii, has two tendons. It has a short head tendon and a long head tendon. The short head tendon comes up and dives towards this bone called the coracoid process. That is not very commonly injured. The long head biceps tendon, on the other hand, is very commonly injured. This tendon travels up the arm through this little groove that we'll see on the ultrasound, and it dives towards the shoulder joint and attaches to part of the labrum in the socket up here. So patients will come in and say, "Hey, I've got pain right on the anterior, the front part of the shoulder." Very commonly, that's the long head biceps tendon. There's a lot of friction that occurs here. There can be inflammation, fraying of that tendon. They can get pain that travels all the way down through the bicep. So this is its anatomic course. This is the pec tendon, the pectoralis major, and these two bicep tendons actually travel underneath that. And if you look, the pec tendon actually sits, it inserts kind of low on the arm. I bet a lot of people imagine it inserts higher on the arm. We'll see that also on the ultrasound. But anyway, just a little bit of an anatomic representation for you so you can better visualize this. Now we're looking at some ultrasound images. So this is the arm bone here. This is the bicipital groove in which the biceps tendon, the circular structure, sits. There's a little transhumeral ligament that sits on top that keeps it in place. And the tendon is circular because we're looking at it in cross-section. So on a patient, imagine this were a tendon. I drew the tendon lengthwise going down his arm. Now we're sort of cutting it like this. So a little bit further down his arm, this tendon was really frayed, and there are many different ways to treat that. So a lot of times, first, I will look at the patient's ergonomics, their mechanics, because the way some people posture and move puts a lot of extra stress on this tendon. But this patient was particularly keen on doing a procedure today to really help squash some of the symptoms that have been driving him crazy. So as it relates to procedures for the medical students or residents that watch these videos, I very seldom put steroid around this tendon. Often I will do platelet-rich plasma, more of a regenerative type of treatment. But in him, we decided to do steroid for a couple different reasons. But the reason I tend to shy away from it is because in this tendon, the Achilles tendon, patellar tendon, quadriceps tendon, I just don't like steroid around those tendons. Those tendons are a bit more vulnerable to rupture. But that being said, I had a thorough discussion with this patient, and that might not be the worst thing for him. So when some people have persistent pain around the long head biceps tendon and friction and inflammation, an orthopedics team will actually go in there and do a biceps tenotomy. They'll cut the tendon so you can get rid of some of that friction. So what I told him is that, hey, if we do an injection and we rupture this tendon, it might actually be therapeutic, meaning it might help your pain indefinitely. Now, a lot of times if they do rupture this tendon, it's of no functional consequence because that short head biceps tendon is still intact, so they don't get any strength loss or anything. But it's an important discussion to have. But you can see in this video, we are using a needle coming in right around the bicep. We're administering some anti-inflammatory medication. So very common condition, lots of ways to treat it, but the ultrasound is very, very helpful in this case of bicipital tendinitis or tendinopathy.